have you noticed that maybe my one eyebrow or eye is slightly higher than the other? They're not symmetrical.
You're right, and everybody's is. So due to volume loss, as we age, we're losing volume through the temples, and due to muscles, you know how one side will be stronger than the other?
Right.
It's really common. Everybody has a bit of brow asymmetry. I'll show you the different things that we can do to try and make that correction. Let me grab the mirror, take a peek. So there's a couple of different ways to do brow lifts. Look in the mirror and make your little frowny face. So see how these muscles are your big corrugators, and you also have a strong procerus in the middle. These are all muscles that are depressors. So when we go in and relax them, they lift. And so they're gonna lift that way. That helps keep them a little bit more symmetrical and a little bit more lifted. There's also two more kinds of brow lifts. That's the biggest one. See how this one's a little lower than that one? We also look at the space in between your lateral canthus and the end of the brow, and notice on this side that it's lower. So this is the main brow lift we put in for people. The second kind, look in the mirror, make your frowny face, is a medial brow lift, and that's where it kind of indents right there above the pupil. You just kind of put like 2 to 3 units, and that one will lift up this way, and just a little. Not a crazy spocked, not a clown face, not a Jack Nicholson, just a little, because it's a small muscle, so you just use a little. That's a medial brow lift, and then this is a lateral brow lift. You can put anywhere between 3 to 8 units right here, and that will lift a little bit up that way. A common, nice, easy way to do it is like 4. So you just put 4 units of Botox, and we'll give that one a little bit of a lateral lift. Yeah, so those are the most common ways we do it. If you also look at your volume, it looks like you have a little bit more volume loss on your forehead on this side, and a little bit more on your temple on this side. So when you and I go in and it's time to do our temples, and right up here, when you replace that, you'll notice it lift, and it'll provide that little bit of structural support in there.
Got it.
Yeah, so those are the different ways we correct the brow. The Botox is the cheapest and easiest way to do it. Usually I'll start with that just because Botox is cheap and easy.
Okay.
Yeah.
Thank you.
You're welcome.